Welcome back to another video topic. Today's topic is cirrhosis liver. Most of the people know cirrhosis liver. Cirrhosis, the literal meaning of cirrhosis means shrunken liver or scarred liver. The other names are liver failure, you can say. As we know in the previous videos, the liver is the biggest organ in our body, almost 2.5 kg. It is well protected below our beneath our right ribs, and is extending from the right side even to the left side. And we all know in the previous videos, the liver has a lot of functions. The prime function is digestion. Apart from that, detoxifying the body. It produces the sole organ which produces albumin. The other proteins we can eat, but albumin the liver has to synthesize on its own. So it's a unique function of the liver, and it also takes care of blood production, and also it purifies the blood. So it has a lot of functions, and it's also another function is clotting factors. It produces a lot of clotting factors for the blood coagulation. So what is now come to cirrhosis liver? Cirrhosis, the literal meaning is shrunken because of repeated injury. The liver goes into scarring, too much of scar, and it goes for permanent and irreparable or irreversible liver damage. That's called cirrhosis. So cirrhosis of the liver is irreversible, permanent and irreparable liver damage. Okay, so what are the signs and symptoms or how it is diagnosed? Usually, as we depends upon the functions of the liver. Since we know the liver has a lot of functions. Like one of the main function is the albumin synthesis. Albumin is a protein. The main purpose of the albumin is to keep the blood thick. If the albumin is not produced by the liver, so what happens? The blood becomes more thin. So when the blood becomes more thin, body wants to make it thicker. So what it does is, from the blood vessels, when the fluid or liquid or thinner blood is running, the body pushes the water outside. So that it tries to make the blood thicker. When the water comes out of the blood vessels, it can accumulate in the body. Like they can have a leg swelling, edema we call that. Leg can be swollen, so that the abdomen can swollen. That's called ascites. The water can collect in the lungs, so they can have breathlessness. The water can collect in the heart. So wherever we have a space, there the water collects. Because the water logging, the weight also will increase, and there will be extreme tiredness. And this is because of the albumin. Then, since the red cell production itself will come down, so they may be anemic. The clotting factors, when the clotting factors are not produced in adequate quantities, then what happens? The blood cannot clot easily, so the bleeding will be more compared to the normal people. They are bleeding and there will be more. And as I told you, the liver is shrunken. Generally, the blood is pumped in a normal person. Blood is pumped from the heart, goes to everywhere. On the return back, it goes to the liver, gets filtered, then goes to the heart. Now the liver is shrunken, so like a hard mass, more than 50% is shrunken, hard. So the blood cannot go freely to the heart. So what happens? It flows back in a reverse way. Because of the pressure, it goes in a reverse way. So they can get portal hypertension. There's a portal vein, the pressure can increase, and then it goes back. Because of that, the spleen get enlarged, and not only that, any blood vessel in the intestine, large intestine, the rectum, they can also get enlarged. It can be dilated, especially when it's dilated in the esophagus. We call the esophageal varices. So the people can vomit blood. So blood vomiting, uncontrolled blood vomiting, because of the varices, as well as that there is no clotting factor and the blood is thin. The same thing can happen in the rectum. People think it's a piles, but it's not a piles. It's because of the varices, dilated blood vessels. They can open up and bleeding will be very torrential. So this is, and because of the clotting factors are less, general bleeding itself will be more, and the platelet level will be less. So the platelets, we know they are very important for the if there is bleeding, they go and stick everywhere and they stop the bleeding. So the bleeding will be more, clotting will be more, and bleeding will be more. And since we said the liver also has a lot of other detoxifying functions. So since detoxifying is not happening properly, the bacteria in the gut, they produce a lot of waste materials. They produce a lot of ammonia. When the ammonia goes to the blood and it goes to the brain, they can get into encephalopathy. Encephalopathy is something like, your brain is completely, they'll be confused or disoriented, or even they'll be in coma, or even they'll have a flapping tremors. They have a flapping tremors, shaking hands. There's not only that, liver also has a lot of other functions like metabolizing the hormones. Since the liver is not functioning, even the male people, they'll have a breast male enlargement. Breast enlargement can happen because the testosterone is not properly metabolized. Since it's not metabolized properly, the estrogen level in the body increases. When the estrogen increases, they can develop male breast. The gynecomastia can happen. So these are the signs and symptoms, main signs and symptoms. And they also have they are prone for opportunistic infections. Okay, these are the signs and symptoms. Why it happens? What is the reason for cirrhosis? The first and foremost throughout the world is alcoholism. So alcohol is one of the main. Alcohol acts as a poison for the liver, and it completely destroys the whole liver, and cirrhosis can happen. The second foremost is viral infections, especially chronic viral infections, hepatitis B, hepatitis C. These are the things. Then in the child age group, primary biliary cirrhosis. These are all the childhood problems, or even sometimes autoimmune. Our own body will act against our own liver. So this can happen. Cirrhosis can happen, and other things like maybe suppose they have excess iron in the body. Excess iron or excess copper in the body, they get deposited in the liver, and they can go for cirrhosis. And certain medications, even simple paracetamol, if they are taking too much, like for even most of the people do it as a suicide attempt, they can get into this kind of thing. And another thing is non-alcoholic fatty liver disease. So as we know we are very well, the non-alcoholic fatty liver disease can progress into cirrhosis. So these are the main reasons for this cirrhosis. There are other reasons, but these are the main reasons. Okay, what is the treatment? So if the person is little active and is not decompensated, then probably they can be treated initially medical treatment or conservative treatment. The medical treatment is to aim to keep the blood thicker. So doctors will give some medications to flush out all the fluids that are accumulated outside the blood vessels, the cavities. So they will give some medicines to pass a lot of urine, and they will restrict their salt intake. They will restrict their fluid intake. Usually the fluid intake will be restricted to 1 liter, and the salt intake will be between 4 to 6 grams. These are the restrictions. And since they are prone for opportunistic infections, they may be given antibiotic, or even prophylactic antibiotics will also be given. Once these complications, when it goes to the next level of complications, like blood vomiting because of the varices, or rectal bleeding because of the varices, then they will do an endoscopy and do a banding to stop the bleeding. The next is if they have gone into the next level of suppose encephalopathy, and if the ammonia level is very high, they can give some medications to detoxify the body. But beyond this, most of the time they will end up in liver transplant. Liver transplant is the ultimate and the last treatment of choice. So mostly once they diagnose cirrhosis, the doctors will advise make them ready for the liver transplant. Of course, liver transplant, everybody know it's a major surgery. We need donors, all these things. So we always say, protect your liver. Always protect your liver. Prevention is better than cure. everybody knows. So avoid alcohol. Once you get viral infection, hepatitis B, C, go to the doctor and get treated. And if you have other diseases like fatty liver diseases, then you get the help of your doctor. Prevent getting into cirrhosis. So prevention is better than cure in cirrhosis. Thank you.